So it
that.
is more of a
called
correlation.
Correlation.
And the team is involved.
Yes, team. It is a team effort also from our side.
Yeah.
And typically around 300 to 500 images we see. So from head to foot. So we take one cut of the body every 5 millimeter, 1 centimeter, whatever clinician describes. So we cover whole body, we dissect out one by one, layer by layer, and coronal, sagittal, varieties of views we take, and we don't miss anything. So we get the proper staging done. So it is a very simple test. Patients usually come with lot of anxiety. We explain them how it is done, and they usually small short movie is shown, or pictorially how brochures will be there. They are given to the patients, and patient party also, they will see that. Then they undergo, initially they go with lot of anxiety, but they come back laughing. So usually it is a very simple test, nothing to be worried.
Doctor, in fact, I must congratulate you. I described it so well. In fact, I can picturize it because the way you told it, I think even a layman, after seeing his report, perhaps he will be in a situation to know like where at least some abnormalities, that much he will come to know.
Yes, he can very easily see, because we give one nice whole body picture, white and black our color. The cancer cells are usually seen very nicely. He himself will see that. And in great detail, we explain, which is useful for a surgeon, because he needs lot of many information, whatever, everything is given, and this is how it is done.
Yes, in fact, doctor, I must admire one more thing. What you have told is basically maybe out of ignorance, maybe out of limitation of the equipments and the skills and the availability of this such type of machine. Often the surgeon at times has to land up, means okay, he operates unknowingly where it has gone. And then, as you have told rightly, that there are other investigations, as and when then we say, okay, you do bone scan, then you do liver scan, then you do this. So it is like on installment. Rather than doing that, I think at one go, if you do PET scan,
yes, it is desirable.
It is desirable.
But let us argue on behalf of those surgeons also. This particular test or this equipment is not available in all the cities. It's very expensive. On an average, this machine costs about 8 to 10 crores.
I see.
And the injections which we give to the patient, that radioactive glucose, on an average it is about 8 to 10,000 rupees, the input cost. So patients may not be affordable.
Correct.
Number one.
I agree.
And surgeon or the treating doctor, he uses judiciously what is the best he can use, and he will do the test. But it is always better, try to convince them. It may be first time, it may be more expensive, but it will avoid many other tests.
Absolutely.
If you put together all the varieties of tests together, it usually adds up much more than a PET scan.
That's what I said, no? Say like cutting in installments, at least.
So it may be it's just a mental block. Oh, you have to advise this test one more after having done that. So I'll tell you why to do a PET scan also beginning. For example, today the technology has advanced so much. The chemotherapy also has advanced so much. Many new kinds of therapies have come. I would like to assure the patients also nowadays, even though they have got a cancer or some relatives have, they need not worry. Today it has become manageable. We may not be able to cure, but we are able to give a better quality of life. May not be quantity, but the quality of life is also important. But the new technology, the newer imaging modality, the newer chemotherapy, best possible surgical techniques make the patient's remaining days very comfortable, or we are likely to cure possibly in the early stages, or you have prolonged disease-free survival. This is what we say. But today, a treating surgeon or a treating chemotherapist, he also wants to know, okay, I have given this drug,
how far it is active,
how quickly he wants to know how it is responding. For example, as a physician, you may be having cough. You will do a blood test. In chemotherapy, you cannot do anything like this, whether it is responding to this therapy or not. What happens, for example, let us say a breast cancer or a lymphoma, a type of a lymph node cancer, they will respond beautifully. Sometimes they don't respond. What is the dictum? You diagnose, then you start a chemotherapy. Then you want to know whether he is responding to it or not. Chemotherapy costs money. Patient wants to know whether the therapy is working or not. And as a doctor, treating doctor, you want to know whether your medicine is working for him or not.
Yeah.
These are answers to be tell. What is the current situation now? You will again advise a CT scan or an MRI scan. But it is anatomical imaging. The changes, anatomical changes take a long time to show up in show the results. Okay, he is responding.
Yeah.
But in the PET scan, today we can tell you with certainty at the end of first chemotherapy cycle only. It's so early.
I see.
There are certain malignancies we can tell even after 1 week whether the treatment has worked or not.
I see.
But I am telling you it's an extreme, but it is likely to happen in future.
Yeah.
So you want to know, the patients also want to be reassured, okay,
Correct.
you want to continue.
Absolutely.
If he is not responding, because it's very simple.
Yeah.
Tumor has taken up this much of sugar. After you give the treatment, they fail to take the sugar. That means the tumor has been killed nicely, the cells are dead, they are not taking up the sugar. So when you give this, the mass, whether it has come or not, come down in size or not, but if the metabolism, the sugar uptake by the tumor has come down, continue your treatment. Otherwise, you will know the result that probably this patient is not going to do well with this established line of treatment.
Correct. Absolutely. Absolutely.
What is happening at present? Standard care. You give 3 to 4 cycles or 6 cycles, maybe 4 months or 6 months, and evaluate at the end. When you evaluate at the end by the CT scan, the mass may be still like that only. We are at a loss whether it has responded or not. Difficult by CT scan and MRI scan. And then you may break the sorry news to the patient, oh, sorry, you have not responded to this line of a treatment. Then there are always the next batch, another type of a treatment. These treatments are usually 2 times more expensive and 3 times more toxic. And a situation might arise, 2 conditions may not allow us to continue the treatment. Either the patient bank balance has exhausted his money, or the patient has money but he cannot take the treatment because of the toxicity by the first line.
Correct.
This is what we want to avoid. If we find out this situation very early, within 1 cycle or before the 2nd cycle, you can change that therapy at that time only, very early.
Correct.
So you have a better chance of survival or better chance of a cure for that patient. This is what is happening right now with this molecular imaging or the PET CT. And I also, when I started this practice, I had a lot of difficulty to convince the nuclear medicine, the other oncology community, because anything new, there is always skepticism, skepticism, because they want evidence that how can you say it is very expensive. The patient has already spent.
Doctor, about how much it costs around?
On an average, it costs most centers in the country 15 to 25,000 rupees, depending upon the injection cost and depending upon the machines, everything.
But doctor, one more thing I just want to add. So, as compared to the money spent over the chemotherapeutic drugs and other drugs, I think this is much acceptable.
Definitely, it is
and
definitely.
As you have rightly said, this is going to save your cost whether you come to know whether this medicine is working or not. Because as you rightly said, after completing 3 cycles or 4 cycles, that is
this is what I had to spend a lot of effort and educate, and it was not taken up by our medical community because it is skepticism, new technology. So then there is one group of doctors in my facility who adopted new technology, and another group of doctors who were saying, okay, we will use it judiciously or whenever it is required. And just 2 years down the line, today the group which was very conservative, they are the most maximum users than the people who adopted, because they have seen the benefit. And you can cut down unnecessary procedures, unnecessary treatments, or you can reassure the patients, look here, with this the tumor mass may not have regressed well, but you are responding well, let us continue the treatment. It is a reassurance for the patients. It helps in a great deal of better management of the patient. And today I think most metropolitan cities, big cities, they have a PET CT, and it is used. And patients initially were a bit hesitant because expense involved, but when you calculate, suppose 3 chemotherapies itself, there are chemotherapies which start from 10,000 rupees up to few lakhs per chemotherapy drugs. So the question of 20,000 rupees additional cost you are going to first do is avoid unnecessary treatment, tell that it is not working, or you are saving a lot of resources also, because most of the patients may not be able to afford. I am talking about maybe a few sets who can afford treatment, but we have to be very, very pragmatic, practical, try to give a maximum benefit to the patient in the least resources available for the patient. It is all right for a patient who is affording, he does not mind, or reimbursement if it is there, it is no problem, they can continue. But still you need evidence. Today we are talking a lot about evidence based medicine, and today the PET CT or molecular imaging is giving a lot of evidence to show that, okay, look here, this is the tumor, this much is the tumor, this is the staging, this is the treatment which is working, whether to continue or not. So it is workhorse in most of the oncology practice across major cities in the country.
Doctor, thank you very much. You have given us a very elaborate uses of this new methodology, new technique, and though it is little more costlier than usual, but I can surely say the amount of money we spend for all in installments for different tests,
definitely.
and at one go you come to know what is your state and how you are responding is really good. It is really, I should say that it is a phenomenon which has, it is a new technology which is used in the interest of the mankind, because it is not a thing. And in the days to come, I think as the more turnover, new technology, still it will be more cheaper. And let's hope that the day will become that we can totally, as you are saying that, okay, we can manage and control cancer. Our patients will live happily and with a successful treatment without undergoing all these unnecessary medications and toxic effects. So Doctor, on behalf of all the viewers of Prudent Media, I thank you very much. So nice of you.
Thank you. Thank you very much.